The following clip contains information relating to COVID-19 and COVID-19 patients and may be a trigger to some.
The following is an interview conducted between two junior healthcare workers from South Africa during the time of the third wave of the COVID-19 pandemic. Breathless is an initiative to highlight the challenges, struggles, and experiences of a frontline worker serving during these times. The interviewer is Dr. Kapil Narain from KwaZulu-Natal. The interviewee is a healthcare worker in Gauteng. Their identity is kept anonymous for their protection.
Hi sister, please could you introduce yourself?
Good day everyone. My name is I'm a professional nurse in one of the hospitals in Pretoria, Tshwane.
Please take us through a typical day at work.
Taking you through a typical day in my workplace, well, it's typically a generally challenging environment. You have to deal with staff shortage most of the times, and it's really difficult having to nurse more than 30 patients, but because we come together to reach a common goal, we always end the day with having reached that goal, which is to care for our patients.
If you were to put this down to one word.
My working environment, or the place that I work at, in one word, as hectic.
According to a paper by the International Council of Nurses, the full story of COVID-19 will not be known for years, but when it is finally written, nurses and nursing will run throughout its narrative as a golden thread that has touched hundreds of millions of people and saved countless lives. Your reaction to this statement?
Well, I do agree with the International Council of Nurses because of all healthcare workers in all disciplines in hospital facilities or healthcare facilities. We are the most people who spend almost half of our day in hospitals caring for the patients. So we will tell the narrative and tell the story of COVID-19 and how it wreaked havoc within our hospital facilities, because we see these patients every day, we nurse them every day, and we carry the burden that is of COVID. You're having to nurse a patient today and tomorrow they're just as frail and they pass on, and you have to continue to the next patient without even internalizing or taking in the fact that you've just lost the patient. And that's how really, really difficult and hard it is. So the narrative of nurses would be one that, I don't know if people would appreciate to hear, but would want to know what we as nurses went through during this pandemic.
Do you feel that the role of nurses has been recognized in the pandemic?
I do not really think that, given COVID, our recognition as nurses in particular has been recognized, or the public and the government that which we serve have actually realized how much of an important role we play, especially in the public healthcare sector. So I do not think that with COVID being there and it still doing what it does best, which is to agitate us and to, destabilize us, our people and its government have actually realized and recognized how important nurses are.
How is the relationship between doctors and nurses in your hospital?
The relationship between doctors and nurses, especially in my workplace, it's a very good one. You see, when you speak of a multidisciplinary team, and speaking of doctors and nurses, I would say that it is a good one, and more so because the professions that we're in are now being infiltrated by young people, and there's a goal that which we want to achieve or want to see the public health or health in general in our country being at. So we do work together to achieve, patient care, and it's not centered around one person or one discipline only. We work together, come up with interventions just so that our patients really get back to health and they're able to go back to their families and relatives. So there's a good working relationship between doctors and nurses.
Do you feel that hospital management and government are doing enough?
I do not feel that the government and hospital management are doing enough, especially now since we're in the third wave, because this is not the first time that we're dealing with COVID. With the first wave, we could forgive, the faults and the mistakes that we made because COVID was new to us. We didn't know how to handle it. We didn't know where to start, you understand. But now, with the third wave, it means we are from the second one, and we thought the second one was just as bad, but the third wave is proving itself to be even worse. So you would assume that the government would be better prepared, would be better organized, and would actually have a plan in place of what should happen should it be that we have a third wave. This is called pre-planning, which is part of management policies, whereby you plan for something even though you're not anticipating that it will happen, or you saying that it will happen, but you should have a plan in place should it be that it happens. And it's very much disappointing to see that each time that we hit a new wave, then we have to go back to reuse our past plans, of when we had a second wave or whatever the case may be, that you have to revisit those old things when you could be saying, actually, no, we have this kind of plan in place. We have built a facility that will deal with only COVID patients, and now you're having to go back and revisit which is not a bad thing, but from that you should have learned that, okay, this is something that we're supposed to do should it be that we are struck by another wave. But it's always old tales, old stories, and same problems. You understand? We are dealing with the issue of PPE even now at the third wave, which is not supposed to be the case, because we know that there's COVID and there's still COVID, especially when the vaccine rollout is this slow. So our government and hospital management, I don't think they are being fair, especially to health workers, and I don't think they're doing what they're supposed to do or was supposed to be done at this point in time. So they are really failing us as the public, and they're really failing us as public servants and healthcare workers.
How is your mental health and that of your colleagues?
Our mental health is in tatters as healthcare workers as a result of a government that's failing us, as a result of a government that's not serving its people and the people who are supposed to go and serve their people. So we are struggling. We don't even have time to debrief because we are under so much pressure. When you work with a purpose and you do not want your work to fall into cracks. You want everything to be done as planned, but you can't do that because you're having a lot of trauma from working in such an environment, and you have to continue as normal. We are not okay, and nothing is normal in our public facilities as it stands right now. So we really do need the mental support, and we really need the psychological support that we can get from anybody at that. It shouldn't be specific to anyone, even ourselves as healthcare workers, because we are continuing as normal as if we're coping, but we are not. We really do need a sit down to debrief and talk about how COVID has affected us.
And finally, what is your message to fellow healthcare workers and to the public?
My message to my fellow healthcare workers is that we only have each other. We only have each other for the strength, the support, and to just keep on keeping on. We only have each other, so let's just be there for one another, because it's truly not easy. And to the public, I would like to say, continue with the precautionary measures, continue wearing your mask, continue social distancing, and if you are experiencing any symptoms, isolate yourself, because you isolating yourself, you are saving a number of people. It's really, really, really not a good side right now to be in public hospitals, even in private, because there's a high influx of COVID patients that are being admitted. So continue social distancing, wearing of mask, and sanitizing even your surfaces. Also, encouraging all the elderly patients, all frontline workers, elderly people to go and vaccinate, because that is the only way we would be able to survive this pandemic. I thank you.
Thanks very much for sharing your experiences and time with us, sister. It's greatly appreciated. And there we have it. Stories from the frontline, from the horse's mouth, from a professional nurse who's working in Gauteng during the third wave of the pandemic in South Africa. If you enjoyed this video and want to hear more, please like, share and subscribe. Thank you. If you'd like to share your experiences through this platform, please let me know.
Thank you for joining us for the second episode of Breathless. Be safe out there. We also pay tribute to those who have succumbed to the virus.